everyone. This is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing Anconeus muscle pain relief treatment video. The Anconeus muscle is an often overlooked muscle in the back edge of the elbow. It is known as the nickname elbow excruciators. Anybody doing a lot of push-ups, tricep pushdowns, or you have a job that does a lot of repetitive excessive elbow extension can involve not just the triceps, but the Anconeus. And in light of our recent videos of lateral elbow pain, one cannot forget the Anconeus muscle. The Anconeus muscle has an origin of the posterior surface of the lateral epicondyle of the humerus, and it traverses down on an angle to the edge, upper medial edge of the ulna and olecranon. It's a triangular shaped muscle, and it can definitely be a cause of lateral or posterior lateral elbow pain. During differential diagnosis, one must know the anatomy, origin, insertion of the Anconeus to reproduce the pain on the patient. So here I can extend my elbow, find the back edge of the lateral epicondyle, extend my elbow, and I have my index, middle, ring, and small finger over it to find this muscle. Once I find this muscle, if I palpate it and it recreates my lateral elbow pain or posterior lateral elbow pain that's worse with elbow extension as opposed to wrist extension with radial deviation, we have now had the accurate identification of a human movement diagnosis, Anconeus muscle hypoflexibility or hypomuscle mobility. How do we treat this muscle? We want to start with the small self-care mobility ball made by the Human Movement Institute and find the back outer edge of the Anconeus. This muscle is known to be exquisitely tender at first. So start with a low dose treatment such as rolling. No problem with getting the triceps here while we're at it, or the triceps tendon. You might be able to sort through more specifically the source of your pain. Rolling is the easiest to do and the least aggressive. However, I can hold the ball in place and mobilize the muscle as well. I do need to cross the posterior lateral edge of the elbow over to the ulna. In this position, the radius is more lateral. Notice that I'm taking the ball more medial, low, to be able to get the Anconeus. Again, I can start with rolling. I am not on the olecranon. I do not want to create olecranon bursitis. I'm below the olecranon and lateral to it and lateral to the proximal aspect of the ulna. After I do some rolling, I can tack and twist, mobilize with fiber. Remember, it's a triangular shaped muscle with diagonal fibers or cross muscle. I can contract it, audiogenic inhibition by extending the elbow, relax, and I can even stretch it as I mobilize it manually. The good news about this muscle is that it's pretty small, and if it's your primary culprit, you can have the pain resolved within a starting dose of 3 to 5 minutes, once a day or every other day, and within a week or so, this pain can be totally gone. If you've liked our Anconeus muscle pain treatment video, please share it with your friends, family, patients, and colleagues. Again, it's an often overlooked muscle that we don't want to neglect because every little muscle needs love. Take care and see you all again soon.